the Organic MD podcast. My name is Carlisle Koash, and I'm here with Dr. Damon P. Miller II. Hello, Dr. Miller.
Hey, Carlisle. It's good to be here.
And we're continuing this series on macular degeneration and specifically things that we can do around that. And today we're focusing on something that you had mentioned in the last session, which is this really exploring supplements as one of the many things, and as actually one of the first things sometimes that your ophthalmologist may suggest or may hand you a little packet of vitamins as they're hustling you out the door. That's probably not a nice thing to say.
That's true.
But it feels like that a little bit, that they're sort of like offered as a consolation prize, as opposed to maybe one piece in an array of things that you can do to help reverse this situation of degenerative eye disease.
Yeah, and we're going to kind of have a little bit of just some things repeat briefly at the beginning of all these podcast sessions. One, the whole focus of this is for you to realize if you or someone you love or know has one of these retinal diseases, macular degeneration, Stargardt disease, retinitis pigmentosa, cone rod dystrophy, on and on, that there are things you can do to reverse the vision, to regain vision lost to these diseases. That's not something your eye doctor is going to say, but it's something we do all the time. We know it's true. And we're here to tell you what we know about it so you can do this for yourself or your loved ones. The eye doctors tend to tell you if they're compassionate and honest, they will say they don't have anything to offer you. There's no drug or surgery. If they're sort of operating more from a typical script, they might say there's nothing that can be done. If I don't have anything to offer you, there's nothing that can be done. There are things that can be done. The one thing, though, the eye doctors do offer now, at least, is after they make the diagnosis, like Carlisle was saying, they recommend you take certain vitamins, or it's actually a brand of vitamins, Ocuvite or something like that. And that's done routinely now because of some research that was done, roughly called the AREDS studies, AREDS, age-related eye disease studies. It's been through a few iterations. And basically, it was really just trying to codify what had been seen in research since the 1950s, even the 40s. Huge body, hundreds and hundreds of peer-reviewed papers looking at what supplements and vitamins and other herbs and things could do to try and help people with these eye diseases. And what all of these studies found, what the ARED studies have found, is that the best you can hope for by taking vitamins and supplements, if that's the only intervention you do, is that they will slow the progression of the disease. These are progressive diseases. They get worse over time. They never get better, but they do get worse. That it'll slow the progression of the disease. And if that's all you do, that's better than nothing. But vitamins and supplements, I don't care what they are, no combination or single vitamin or supplement has ever been shown to stop the progression of the disease or to reverse the diseases. And I just stand by that statement. I'll say it again. Vitamins and supplements will slow the progression, but they will not stop the progression of the diseases, and they will not reverse the diseases. They don't lead to recovery of vision that's lasting. And so you got to do more. And don't worry, we're going to be talking over the next sessions of this. This is an 8-part series. This is number 2. We're going to be talking about the kinds of things you can do. But we just wanted to be clear that supplements are important, but they're necessary, but they're not sufficient. And one of the reasons they're important, especially if you're undertaking a program like the one we're going to be laying out, where you expect regeneration of some of the most difficult or some of the most complex tissues in the body, the retinal tissues, if you're going to be trying to regenerate those, number one, you need the raw materials, the building blocks that would rebuild retinal cells, things like taurine and DHA, the omega-3 fatty acid, things like lutein. You need things that are going to block some of the inflammation that can occur. You need things that are going to improve blood flow. So there are things like vinpocetine and some of the other therapies we're going to be talking about, but there are supplements that can actually, in a mild way, restore normal blood flow and protect the health and integrity of the blood vessels. And then there's some very specialized supplements that actually can help with regeneration. Well, that's a complex subject. We're going to devote an entire one of these podcasts, I think episode 6, to tools and supplements that can support regeneration that are safe and backed by peer-reviewed research. And yeah, so again, supplements are necessary. They're not sufficient. We're going to talk about specifics of these in later on. I don't want to get too bogged down with it, but we basically recommend the things I just named, the taurine, the lutein, the DHA, kind of a broad spectrum vitamin and mineral, which matches some of the things that were in the ARED studies, some specialized supplements that improve stem cell function, stem cells, adult stem cells. That's what helps with regeneration of anything that breaks in your body. And then maybe, if needed, some probiotics or something to support gut health. Everybody has kind of an unhealthy gut. So at least at the beginning, when we're working with people, we're doing that. So those are the basics that we do. And we don't like any of the one pill from one bottle kind of multivitamin mineral things that the ophthalmologists give out, that we just don't find that they work very well. So we'll have some more specifics on particular recommendations about brands and things. We don't manufacture these, but we do have brands we like. So, that's really the simple thing about supplements. People tend to get hooked on, this pill is going to help me. And Carla, we've talked about that before, that kind of mindset.
Yeah, I think too, it's so powerful, I think, when you become invested in your own knowledge and curiosity. This could be applied to all sorts of things. Taking that time to learn, okay, what's in the supplement that I'm getting? Can I be more precise, really evaluate? I think the thing that I've appreciated, Dr. Miller, that you've done for years is really take the time. Let's look at all these different supplements and let's find the ones that are the most effective, as opposed to sometimes they're the cheapest, sometimes they're not. But that sort of self-knowledge of being aware. I remember just the talks you've done around healthy oils, and a lot of people are like, oh yeah, if I take fish oil, that'll be fine. And I'll get all the stuff I need from fish oil. And sure, yes, that is true. However, also the source of that fish oil is important. And so there's this, again, it's this thing of, I just take the top level of information that maybe I'm given, and I don't do further exploration. It doesn't mean you spend weeks and weeks doing some intense deep dive. But for example, again with fish oil, where you pointed out that fish naturally, the things that are beneficial in fish oil isn't because the fish naturally have that. It's because the food they eat, like kelp and things that have all these great nutrients in it, they eat those things. That then gets stored in their fat of their body. And then when we take that fish and eat that fish, we are getting that benefit. But if that fish was farm raised and just given random, as you, I think, have described it, Purina fish chow, well, that fish actually doesn't have those things, even though it is fish and it's fish oil, and I'm taking that fish oil, but it doesn't have those nutrients because I haven't taken the time to learn, well, how do I get those things? Why is it that this version of D3 as opposed to that version of D3 or C or any other substance? Why is it that one can work and the other one doesn't work? And I think that's that level of detail that we can take and explore. I mean, you've done a lot of the work for people, which is great. And I just think I would encourage people always to be curious and to look at the label and do those kind of things. And that these things that we're talking about, they're not a cure. There's still an underlying issue because it's a degenerative disease that is connected to something a little bit deeper in terms of genetics, that you still have to do these things to help manage and treat the issue so that it doesn't manifest as strongly, but it doesn't necessarily mean you're going to be cured of it. And I think that's important, that it doesn't have that end result.
Yeah, well, I think what you're saying there is kind of true, really, of all the things that challenge our health, or most things that challenge our health. Most things really, it's not about cure; it's about managing it. And so, I said in the first podcast that we did on this, there's most of the time, if you have one of these degenerative retinal diseases like macular degeneration, that's the most common, Stargardt, RP, retinitis pigmentosa, but you have an underlying genetic problem that predisposed you to it. Your genes aren't your destiny, so a lot of people have that abnormal gene and live to be 90, 100 years old and never have an eye problem, but you have a gene that predisposed you to it. And really what you're trying to do is just keep yourself healthy enough that gene never gets a chance to express itself. So in a sense, you're managing things. You're managing your health to fend off chronic disease and degeneration. And that's true of, I don't care if you're talking about cancer or infectious disease or autoimmune disease or diabetes or heart disease or on and on and on. You're managing things, and you're trying to manage them in your favor. So that's a good way to put it. And I like it too. I was just thinking here, in the same way that, everybody says we are what we eat. Well, if you're a fish, you are what you eat. So there you go. Just kind of nature's rules of order.
That's true, right? If you start eating Purina fish chow, it's probably not going to help you.
So. No, it's not. And that's a whole nother podcast, is Purina fish chow, which gratefully you should be grateful. We're probably never going to do that one. But it's a good subject. I I used to have a picture of a pallet full of Purina fish chow. There really is such a thing. But it doesn't make the healthiest fish. Okay. Well, I think, we've milked this one for all it's worth. So I just want to just leave it that supplements are an important part of taking care of your eye health, but they're not sufficient. And keep with us here. This is second of an 8-part series. We're going to be helping you learn about what you can do to reverse vision loss that has occurred because of degenerative eye diseases like macular degeneration, Stargardt, and retinitis pigmentosa. So thank you. We'll see you again in about a week.
Have a great day.
Thanks. Bye-bye.